MGUS and smoldering are two premalignant conditions that are characterized by a risk of progression to symptomatic multiple myeloma. We discuss about which is the approach to these patients, what we have to do when we have the diagnosis of MGUS or smoldering myeloma, which type of exam we have to do. We discuss about the role of bone marrow biopsy and the skeletal survey in this type of patients. Now we are able to identify which are the risk factors to progression to myeloma. In MGUS subject, we use to evaluate the size of M component, the type of immunoglobulin, and the ratio between free light chain kappa lambda. So we are able to stratify patients in 4 groups of risk, and we perform the follow-up of these patients based off this risk factor. We speak about how frequently we have to do to perform the follow-up in this type of patients. The recent guideline suggests that we have to repeat the exam after 6 months in MGUS, and then decide on basis of this risk factor to follow patients every year, or in the low-risk patients, and especially in a very elderly patient, we did not need to have a regular follow-up. Regarding smoldering multiple myeloma patients, we discuss about the possibility to treat these patients. Smoldering myeloma is a premalignant condition, but the risk of progression of smoldering myeloma is higher as compared to MGUS, and some high-risk smoldering myeloma patients need to be treated. In this moment, patients are enrolled in clinical trial. There are some clinical trials that demonstrated that early treatment in this type of patients induce a better overall survival as compared to patients that are not treated with only observation. We also discuss about how identify high-risk smoldering multiple myeloma patients, because there are many papers that suggest different risk factors for progression to multiple myeloma. Also in this case, is important the number of plasma cells into the bone marrow, the size of M component, the type of immunoglobulin, the presence of immunoparesis, but also biological factor, the presence of cytogenetic abnormality in the bone marrow plasma cells, the gene expression profiling are potential risk factor for progression to multiple myeloma.